Chairman, we're live.
Good evening, everybody, and welcome to the first virtual Cabinet meeting at the London Borough of Hillingdon. This virtual meeting is also being broadcast simultaneously on the Council's YouTube channel, Hillingdon London. My name is Councillor Ray Puddifoot, and I am the Chairman of this meeting. Before we start, some important online housekeeping for everyone present. Please ensure any mobile phones around you are on silent. Please keep your microphone muted when not speaking, and then unmute to speak. As Chairman, I will call on those to speak during the meeting. In terms of technical meeting control, if any Cabinet member leaves a virtual meeting partway through for a period of time, e.g. through a lost connection, I will continue the meeting unless we become unquorate, which is less than 3 councillors. Before we move on to the agenda, I would like to do a roll call of those present to confirm attendance to those watching online. Please indicate you are present when I say your name. Councillor Jonathan Bianco.
Present.
Councillor Susan O'Brien.
Present.
Councillor Keith Burrows.
Present.
Councillor Jane Palmer.
Present.
Councillor Philip Cawthorne.
Present.
Councillor Douglas Mills.
Present.
Councillor Richard Lewis.
Present.
Councillor Duncan Flynn.
Present.
Thank you. We will now move on to the agenda. Apologies for absence.
Chairman, all members are present.
Thank you. Are there any declarations of interest in matters before us this evening? I will pause for a little while, and if there are no responses, I will move on and assume there are no matters to declare. Thank you. The first item is to receive and agree the minutes of the last meeting. Again, I shall take these minutes as agreed unless there are any comments. Thank you. Just to confirm, there are 3 reports tonight. They are all public reports. There are no private reports on tonight's agenda. The first item, agenda item 5, which is page 11 of the agenda, Hillingdon Council's response to coronavirus. This is quite a lengthy report. I will give some of the detail from it, but it's divided into 4 parts, which highlight the continued delivery of key local services to residents and how services have adapted proactively and with innovation to respond. The new community services and assistance established to directly support those affected by the pandemic, including vulnerable residents and businesses. Recent emergency decisions taken by myself for the Cabinet to ratify, and how at this unprecedented time the Council and community have come together moving forward to better times. The report has 3 recommendations. 1, welcomes the substantial effort by the Council and the community groups to deliver an unprecedented local response to support Hillingdon residents during the coronavirus national emergency. 2, requests the Deputy Chief Executive communicates the Cabinet's gratitude for the critical work by Council staff, particularly frontline workers during this time. And 3, Cabinet ratifies the emergency decisions taken by the Leader of the Council as set out in the report and for formal public record. As I say, this is quite a detailed report. It's divided into 4 parts, and part 1 is the continued delivery of key services, adapting others in response. The report indicates what the position was as at May the 11th when the report was finalised. And at that time, playgrounds, outdoor gyms and tennis courts were closed. Tennis courts have subsequently reopened. Leisure centres remain closed. Hastings and Uxbridge golf courses were closed. They are now open. So we are moving even within terms of 1 week. Still lots of things not open. The Battle of Britain bunker, the theatres, adult learning centres and libraries, for example. A number of popular events also had to be cancelled. VE Day, 75 street parties, the family fishing fun days, which we would normally hold in July and August, the Easter Fiesta, events were cancelled in Hayes Community Family Fun Day. Having said that, Hillingdon Library Services, for example, with residents unable to visit libraries and access physical stock, many have turned instead to a host of online resources available from the library's website. The service is adapted to enable online membership for residents who weren't previously library members to access online resources. During April, Borough Box, borrowing of e-books and e-audiobooks, has increased by 59%. New titles have been added to the collection to meet demand. Press Reader, which is reading online national and international newspapers and magazines, has increased by 48%. Britannica Online, e-books, non-fiction and learning has increased by 67%. RB Digital Magazines has seen a 28% increase. And Transparent Language Online, language learning, has seen a 171% increase. Sports and physical activities for older residents. With leisure centres and physical activity events suspended, this has impacted on older people and particularly the Dementia Friends coffee mornings held in libraries. Chair-based exercise sessions held in libraries and tea dances, 5 in total, and the walks programme, 20 across the borough. Therefore, staff have telephoned or emailed 414 residents who were registered on these schemes to ask after their welfare and general well-being and signpost them to any support they require. 57% have requested follow-up phone calls. Social care, early years services. Through the use of the special government grant to local authorities, I agreed to provide home care outreach and bed-based providers with social care a one-off lump sum at the end of March, equivalent to 10% of their business turnover with the council. This amounted to £1.9 million in total. In addition to this, the council has agreed to pay in advance each month rather than in arrears based on actuals. The council has been supporting providers of social care services with emergency supplies of PPE, personal protective equipment. Over the last 6 weeks, the council has distributed more than 600,000 gloves, masks, aprons, eye protectors and hand sanitisers to council and contracted providers in the borough. The council has provided 18 step-down flats at Parkview to provide an urgent response to out-of-hospital care during the pandemic. The Merriman's Respite Care Unit was closed on the 23rd of March due to the nature of the vulnerable people that use that service, and to further support people leaving hospital, a 9-bed unit of residential care for older adults is being provided to those with more complex needs. All care providers through the pandemic are being supported by council staff who make calls to every provider every day, 7 days a week, to ensure that they have the staff, PPE required and are completing the London-wide situation reports that allow the council to monitor their performance and highlight any issues closely. Under adult social care, whilst the Coronavirus Act 2020 introduced the option of Care Act easements in the event that councils were unable to meet their existing statutory duties, in Hillingdon, adult social care has not needed to utilise easements to date and has continued to meet all aspects of its statutory duties, continuing with the essential visits to older people requiring care wherever this is necessary. Children's services. Children's social care services have continued to support children at risk of harm. Children who are supported through a child protection plan continue to be visited face-to-face with support to ensure they are safe from harm. All children with an allocated social worker, including children looked after and those who have left care, continue to be in touch with their social worker by phone and video conferencing on at least a weekly basis. A whole approach continues to be taken, supporting foster carers and residential provision with advice, counselling, extra resources or deployment of staff from other parts of the service. There has continued to be stability and continuity for our children in care during this time. The majority of meetings involving professionals, families and children have been conducted online, and this has had a positive impact on participation of children, families and professionals who otherwise would not have been able to travel to meetings. Staff have shown an amazing level of determination and dedication and courage in supporting and keeping children in Hillingdon safe. Staff use the correct PPE when visiting to ensure they are keeping the families and children safe. Schools. In response to the pandemic, the council's education team have been supporting schools, childcare providers and other settings to remain open for vulnerable children and children of critical workers. The council has also been coordinating with schools to order laptops for vulnerable Year 10 pupils. School place modelling is also being adapted to manage possible changes in demand as the UK moves out of lockdown. Parks and open spaces. As one of the UK's greenest boroughs, the council has kept its many parks and green spaces open, but has advised residents to ensure they observe government guidance on social distancing and exercise. Ruislip Lido has electronic display signs displaying these important rules. It's also important to note that despite the pandemic, the usual grass cutting and horticultural work continues across all open spaces and roadsides. Parking. The council introduced a free emergency parking permit that residents can obtain during this time, which allows them to park in the parking management schemes where they live. This reflects the higher than normal number of residents' vehicles that are being parked on residential streets. Additionally, the council has removed charges and time limits from all council public car parks and pay and display bays to provide additional parking capacity for residents and key workers. A temporary mortuary has been built at Breakspear Crematorium. The original capacity for this temperature-controlled facility was 800, but it was quickly increased to 1,600. The temporary facility was built and operational within 7 days on the 31st of March. This incredible achievement was made possible with support from across Hillingdon services areas and contractors, such as those providing site fencing, CCTV, ICT, phones, pest control, cleaners, security, clinical waste removal, general waste removal, staff welfare, catering and specialist cleaning products. Whilst it has a capacity for 1,600, just to get it into perspective, on Monday of this week there were 28 bodies in that mortuary. The staff registration team, part of the Democratic Services, have been handling all the death registrations, and as at the 7th of May there have been 267 deaths registered with a cause of death as COVID-19 in Hillingdon. Housing services have remained fully open, and since the 1st of April, 222 residents have approached for advice. Of these, 113 have used the service's online assessment and application tool. In partnership with the Customer Contact Centre, the council have opened 3 additional emergency phone lines for residents to be referred directly to caseworkers where necessary. To ensure that the council makes best use of its housing stock, officers are using void properties on a temporary basis as accommodation for homeless families. To date, 16 properties are being adapted for this use. The pandemic has had a significant impact on tenants' household finances, so council officers have been redeployed and have been making proactive calls to tenants in high-risk groups, including those subject to court orders and other repayment arrangements, to offer support, guidance and to renegotiate payment arrangements. Debt management advice has been offered alongside support with making applications for discretionary housing payment and maximising welfare benefit take-up. Tackling domestic abuse has always been a key priority for Hillingdon. Like the council during the pandemic, the government has placed additional focus and support on this, given the national stay-at-home requirements. As such, the council has been prioritising a number of new cases of domestic abuse. In February 2020, there were 14 cases being managed. By the end of April 2020, this number had increased to 20. Waste collection, recycling and street cleaning. Hillingdon has continued to deliver its gold standard waste collection and street cleaning services during the pandemic, and this has received much praise from residents. Other councils have had to reduce their waste collection services, and some, such as the London boroughs of Harrow and Richmond, suspended their green waste collections. By contrast, Hillingdon continues to operate its weekly collection services, and in fact in April 2020 was the highest ever month on record for collecting green waste, 2,278 tonnes. Additionally, the street cleansing teams continue to keep our roads, pavements and town centres clean. During the pandemic, they've been operating with 1 driver and 1 operative. Residents have continued to order recycling bags via the website, which are being delivered on a daily basis. To prioritise the maintenance of free use to rubbish and recycling collection, the council temporarily suspended its usual bulky waste collection service, has recently reintroduced this service for a small charge to cover our service delivery costs and to ensure that we can meet demand. The small charge is £25 per collection, which is 40% cheaper than the average of our neighbouring boroughs. And of course, for residents over 65 and those in receipt of personal independence payments, the service is free. Following a temporary suspension, the council reopened the Harefield Civic Amenity site on Monday, the 11th of May, for Hillingdon residents and registered trade waste carriers who have a credit account with the council. Highways and road repairs. Even with less cars on the road due to the government guidance, essential highway and street lighting routine team service works have continued, including gully cleansing, potholing, street light fault repairs and lamp night scouting. We have continued to resurface major roads because at this time our major roads have been less busy, but we have for the moment put on hold resurfacing pavements of residential streets because they are at the other end of that spectrum. They are much more busy than usual. Technology solutions to support our operations. If the arms and legs of a person are council services, the council's ICT team have been their backbone. ICT have ensured that council staff and services and the technology and systems they rely on have been able to operate effectively during the pandemic, with many staff working remotely at home at this time. The second part of the report is new community services and assistance directly supporting those affected by the pandemic. A major part of this has been the setting up of a new community hub. The council set up a community hub and has been working with Hillingdon for All to provide a range of support to those residents unable to leave the house because they are ill, because of their caring role, or if they are self-isolating due to the coronavirus and may not have a friend, neighbour or family member available to support them. The community service has sought to offer peace of mind to residents and has been offering the following services daily: emergency food parcels to eligible residents, bespoke food shopping, prescriptions, pharmacy registration and regular prescriptions delivered to home, befriending, regular friendly telephone calls for those lonely and isolated or struggling with emotions, information advice on welfare and benefits during this time, and even dog walking and posting mail. 113 of our staff have been engaged on these activities. The council facilitated a COVID-19 mobile testing unit at the Rice St Manors Linden Avenue car park on Tuesday the 30th of April and Friday the 1st of May. Facilities operated by the British Army, and over the first 2 days tested 500 council and social care critical workers. Extremely successful on both days, which were fully booked. Support to business and the local economy. The UK government has set out a substantial package of temporary, timely and targeted measures to support employees, employers and businesses throughout this period of disruption caused by coronavirus. The council has worked with the Hillingdon Chamber of Commerce and Uxbridge Bid to ensure businesses in the borough are aware of these measures and also the financial support available to them. This vital information is available and updated regularly on the council's website. The council to date has received approximately 46 million of government grant to support local small businesses by way of business support. At the end of April, just over 2,100 grants have been paid out for a total value of nearly £30 million. The council has also been applying the extended business rate relief to qualifying business rates worth just around £70 million at this time. Part 3 of the report, these are the emergency decisions taken by myself which need ratification tonight. 6th of April, I approved the essential changes to the council's contractual arrangements which were necessary to keep business running during the pandemic. 7th of April, accepted the government's offer of £6.8 million. This was the first grant money we received because of COVID-19, and immediately agreed to spend 1.87 million of this to support our social care providers in maintaining resilience over the coming months, as I referred to earlier in the report. Also on the 7th of April, I agreed a 10% temporary uplift to permanent frontline social care staff salaries, amounting to £197,000 revenue to reflect their critical role. Also agreed a grant of up to £50,000 to fund H for All to support the local voluntary sector. Release £49,000 of capital funding for urgent works to secure the Hillingdon Sports and Leisure Centre following its temporary closure. Approved the £25 fee and the introduction to special bulky waste service and no charge for residents over 65, to which I referred. I also agreed to waive the parental fees at early years centres for those unable to send their children to them for the period that the early years centres remain closed, and approved the Council's tax discretionary hardship fund policy following receipt of the government funding of £2.12 million to reduce council tax liability in the current year by £150 for all working age claimants in receipt of council tax reduction, with remaining funds for discretionary hardship fund. Part 4 of the report is entitled Working Together and Moving to Better Times Ahead. As the Council looks forward, residents should be aware that the reopening of its popular facilities and the resumption of events will largely be dictated by UK government advice. However, in the meantime, key services will continue for residents, even if accessed in a different way. A comprehensive recovery plan is being developed for agreement by myself to resume and operate services in a safe and coordinated way to meet what we are referring to as the new normal. The Council's clear mission throughout this pandemic has been to continue to provide key services and support residents, moving together to better times ahead. I'll briefly refer to the appendix to the report, which is extracts of resident feedback. The Council has received literally hundreds of compliments from residents thanking staff for continuing to deliver essential services and support them during this coronavirus. The appendix has a selection of those compliments and thanks received for various service. But I think if I just mention a few general residents' comments, which are, I would just like to thank you all for your excellent services during this difficult time. I do think that we are so fortunate to live in Hillingdon. The Council are committed to putting their residents first. We would like to thank the efficiency of the Borough's staff as they have carried on with essentials during this lockdown crisis. Many thanks. I would like to say a big thank you to all the employees who are still working, providing great service to all the residents. I'm proud to live in Hillingdon. I want to make sure this council gets the praise it deserves for all the wonderful things we are privileged to carry on receiving, from rubbish collection to open parks. Thank you all very much. That thanks is directed at our staff who really have gone the extra mile during the past 8 or 9 weeks. Now that completes the report, so I will return to the recommendations that we've got to agree. But before I ask for those recommendations to be agreed, a number of Cabinet members have indicated that they wish to speak, and the first of those is Councillor Jane Palmer.
Thank you, Leader. I wish to echo and reinforce the comments in this Council's response to the coronavirus, and in particular those under my social care portfolio. It is important that I take this opportunity to place on record my thanks and those of the residents we assist for the care given to them by our social care team. Their hard work, diligence and flexibility has ensured our most vulnerable residents have continued to receive the social care they deserve and are used to from this council. It is to the team's credit all aspects of our statutory duty have continued to be met. To also include the extra support allocated to some of the care homes and our community safety teams who, in spite of the difficulties being well documented in the news about the rise of domestic abuse, have carried out with well-planned, and our victims have continued to be assisted. Finally, thanks to the staff that came into social care from other areas of the council, particularly from our libraries, who did much to contact isolated, lonely residents. We can be rightly proud of the work that our staff have carried out in the council. Thank you, Leader.
Thank you, Councillor Palmer. Councillor Richard Lewis, you indicated.
Thank you, Leader. In a crisis, there are those who step up to the mark, and I really want to focus and praise my amazing library staff, who not only have stepped up, but have surpassed all expectations by being so kind and caring, in particular for our elderly and vulnerable residents who regularly use the library service, as well as for all of our residents who have come along and found the service as new in order to break the monotony of social isolation. In addition to the library's digital offering, which you spoke of earlier, over half the library service staff are now working on the COVID-19 response hub, and 10 library staff are assisting the sports and physical activity team in contacting residents with dementia. Libraries are continuing to serve our older residents by contacting older residents who are known to the library staff through regular visits to the library, inquiring after their well-being and ensuring that they are safe and well. I would also like to pass on some of the wonderful comments from residents about the home and mobile library services, where people have said that they don't know how they would have done without getting the books to read, and that they were amazed about how quickly the books arrived. We've also had great comments about our social media offering. For instance, this looks amazing. Thank you so much. My little ones will love making and using this, as well as thank you, Hillingdon Libraries, for this excellent activity. My Year 6 daughter really enjoyed it. The majority of the staff who volunteered for redeployment are actually from the library service, because they were picked for their excellent customer care skills that they have developed over the years in the libraries. All three of the library and three of our library service members are working at the Breakspear Hub, bringing their level-headed practicality, tact and sensitivity to this incredibly difficult environment. In these difficult times, it's wonderful to realise that we have some amazing officers who can touch people's lives with kindness and caring for our community. Leader, in closing, may I please pass on my personal thanks to them for making so many of our residents' lives better and more bearable in these difficult times. Thank you.
Thank you, Councillor Lewis. Councillor Susan O'Brien.
Thank you, Leader. I'd like to thank the Education and Children's Services teams for their hard work, diligence and their continued support to the children of Hillingdon. Since the 20th of March, the date of the closure of schools in the UK was announced by the government, officers in the council's education team have continued to work with schools, recognising the significant impact on everyone's everyday lives. Yet for officers, it has remained as business as usual. The admissions teams have carried on with the task of placing children in schools for the new academic year. The education team have been supporting schools, childcare providers and other settings to remain open for vulnerable children and children of the essential and key workers. Since the announcement from the government on the 11th of May, officers have been working with schools on the proposed phased return for early years, Year 6 and Year 10 children onwards from the 1st of June. Officers have been working through the guidance with schools to ensure that protective measures are in place for their return. In addition, considerations for those children that will remain in a virtual distance learning setting are also part of that consideration. All council-run special educational needs schools have remained open. The team has continued to work on the educational health and care plans and have also established a virtual special schools forum, one for schools and one for parents and carers, who meet fortnightly. As the leader has previously mentioned, the children's social care teams continue to support children and young people during this time by maintaining contact with children at risk and children on personal protection plans, who continue to be visited or have virtual meetings to ensure that they are safe. Children who were looked after but have since left the council, left the care system, and for schools designated safeguarding leads and also communications with foster carers. We are very fortunate to have such committed officers who in a crisis remain steadfast in their vocations. I agree with tonight's recommendations and the decisions that have been made. Thank you.
Thank you, Councillor O'Brien. Unless any Cabinet member indicates otherwise, I shall take those recommendations as agreed. Thank you. The recommendations are agreed. We now move to agenda item 6, page 45. Carer Strategy 2018-2021 update. Councillor Palmer.
Thank you, Leader. This report before you provides a comprehensive update on our carer strategy and the 2019-20 delivery plan that arises from it. I will just point out a few highlights that support the health and wellbeing strategy of developing high quality social care and health services within the community. As of 2011, there were over 25,000 carers in Hillingdon, providing significant unpaid care to others. Like all of our services, we do not work in isolation, and the successes contained in this report are attributable to many, including carers themselves. Council achievements have included a marked improvement in carer engagement, due largely to the continuation of 2 borough-wide forums where carers can ask questions around specific issues. An online training package has been co-produced with Hillingdon carers, and this is due to be rolled out to all staff, but particularly those on the frontline service, including our librarians, and those staff who may not have a full understanding of what carers' roles are. Adult social care has developed a mechanism for identifying and recording people who have multiple caring responsibilities, the double carer. This was highlighted by the Council's carers champion, Councillor Hagger. Domestic abuse training has also been made available to carers and talks given by our lead officers so that those in need of support are aware of the pathways. Our clinical commissioning group has ensured carers' leads are in GP surgeries, and there are 44 out of 45 GP practices where there is a nominated staff member who receives bespoke training as a carer's lead. This enables carers' information packs can be available in the waiting room, working towards flexibility of appointments for carers. CNWL Mental Health Service has ensured carers can be involved in any aspect of clinical care that the service user gives consent for example, a crisis appointment. This support is extremely valid, especially when caring for a person where capacity is compromised, for example, dementia. A leaflet has been co-produced with carers and service users that explains roles of carers in an outpatient appointment. Hillingdon Carers is the lead organisation for the consortium of third sector organisation known as the Hillingdon Carers Partnership. Many valuable support services are provided through this successful medium. The advice team has secured $700,231 amount of money in carer-related benefits in 10 months from April 2019, and during 2019 broke the £1 million mark, securing benefits for families, thus improving household incomes. The Family Support Services supports complex families where young carers are affected by parental substance misuse and or mental health issues. This has assisted school attendance to rise from an average of 52.7 to 94.7. I can only highlight a few of the many successes of this strategy and partnership, but there are many. The priorities going into the rest of 2020 and 2022 will be developing a guide for those who suddenly become a carer, piloting an interpreter service to the south of the borough to address greater need, designing information for children with autism and or learning difficulties, continuing to work with and for carers and to welcome 2 carers into the strategy group from December this year. My thanks to our partners, particularly Hillingdon Carers and our council carers champion, Councillor Hagger, whose knowledge, dedication and passion does much to improve services for our residents. The recommendations are in front of you. I so move. Thank you, Leader.
Thank you, Councillor Palmer. The recommendations are that the Cabinet notes progress against the Carer Strategy Delivery Plan activity for 2019-20 and the work that the Council, its partners and Hillingdon Carers Partnership does to support those with caring responsibilities in the Borough. And 2, approves a proposed approach to supporting carers for the next 2 years as set out in this report. Again, unless any Cabinet member indicates their disagreement, I will take those recommendations as agreed. Thank you. The recommendations are agreed. Agenda item 7, page 73, self-build and custom-built housing charging eligibility criteria. Councillor Keith Burrows.
Thank you, Leader. The Self-Build and Custom House Building Act 2015 imposed a duty upon relevant authorities, including London boroughs, to actually maintain a register of individuals or association of individuals that wish to seek and acquire a service plot of land in their area in order to build homes for their occupation. New regulations then came out and were published in October 2016, which enabled local authorities to set local eligibility requirements in addition to the actual general national requirement, and also to start charging a fee for entries on the Self-Build and Custom House Building Register and an annual fee to remain on the register. This report, Leader, seeks approval to agree to the setting of local eligibility requirements and also the introduction of fees for entry and retention on the Hillingdon Self-Build and Custom House Building Register. There are local eligibility criteria, which I know my fellow Cabinet member wishes to speak on a bit later. I will just run through the recommendations because there are a number of them. The first recommendation is that Cabinet approve the principle of introducing local eligibility requirements criteria so that Hillingdon Self-Build and Custom Build Register can be split into 2 parts. Notes that an equalities impact assessment will be carried out into the Council's proposed local eligibility criteria and therefore approves a public consultation to be carried out on the following local eligibility criteria for joining Part 1 of the register. And that is 2A, residency in a borough for at least 10 years prior to the date of application, or B, in the service of the regular armed forces or have served in the armed forces within the previous 3 years prior to the date of application, or 2C, able to provide evidence of access to sufficient resources to purchase land of at least 225,000. And 2D, for associations of individuals wishing to be added to the Hillingdon Self-Build and Custom Build Register, at least 3/4 of the members of the association must meet the local connections criteria above and be able to demonstrate that as association collectively has sufficient financial resources to purchase a plot large enough to accommodate its members. Recommendation 3 is approve public consultation on the national eligibility criteria for Part 2 of the register, which requires the applicant to be over 18 years old and a British citizen or national of an EE state, and I'll come back to that one in a second. And 3C, seeking to acquire a service plot of land to build a house to occupy as a sole or main residence. Recommendation 4, approve public consultation on introduction of fees for joining each part of the register as follows. Fee for Part 1 of the register, £90 for entry, an annual retention fee of £30. And B, fee for Part 2 of the register, £45 with no annual retention fee. Recommendation 5, the outcome of the public consultation together with a full equalities impact assessment to be reported back to Cabinet for consideration prior to any changes actually being made to current practice. I mentioned that I would come back to recommendation 3B because where it states nationals of an EE state, this would only continue to apply in accordance with future legislative provisions implemented at the end of, obviously, the Brexit transitional year, which we're currently in. So there may be changes made to that. There is just one other point I would like to point out, and that is that only 2/3 of the current 233 applications on our register are actually from Hillingdon residents direct. They are from other areas outside, and the reason for this is that the Act and the provisions of the Act do not limit the number of registrations you can have in any authority. So you can register in a number of authorities across the country. I will leave it there, Leader, because I've gone through in detail with the recommendations, and I will hand back to you. Thank you.
Thank you, Councillor Burrows. Councillor Philip Cawthorne.
Thank you, Leader. Beyond what we've heard from Councillor Burrows, it's worth explaining, I think, briefly the background to the 10-year residency component within the recommendation. It's absolutely right that we should use the opportunity afforded by the 2016 regulations to make sure our approach to self-build and custom housing is consistent with our existing 10-year eligibility policy, and of course, as it affects our armed forces personnel. As the table on page 79 shows, ours is a more exacting eligibility requirement than that of other authorities. We've never made any apologies for that, and we certainly won't be starting now. And it's entirely consistent with our residents first approach. The 10-year rule, Leader, as you and I both know, has been subject to frequent legal challenge over the years. But we sustained it in part through a process of regular reviews and the application of a degree of flexibility on occasion. Although we are under no statutory obligation to consult in the circumstances, I think it's sensible and prudent for us to do so. The number of these applications may not be that significant in the scheme of things, which is perhaps just as well, given the potential to impact on the delivery of housing units. But it is right, I think, we take the opportunity to make sure that our approach to this is consistent with our wider policy platform regarding access to housing opportunities across the borough. I await with interest the outcome of the consultation, and in the meantime, I support the recommendation. Thank you, Leader.
Thank you, Councillor Cawthorne. Unless I hear any Cabinet member indicating otherwise, I shall take those 5 recommendations as agreed. Thank you. The recommendations are agreed. Well, thank you, Cabinet. That concludes tonight's meeting. Can Cabinet members please remain on mute and stand by until the broadcast has ended? Thank you for watching, and good night.